You want to stay away from commercial animal products, commercially grown animal products, because the animal fat has hormones in it. So even if you say, well, I'll eat organic animal products, organic meats still have fat in it, and the fat or the estrogens from the animal we're eating, so we're incorporating that. And anything the animal's eaten or been exposed to, we're exposed to.
All right. Hi, everybody. Thank you for being here tonight. Dr. Pamela Atkins is going to speak to us about breast health prevention via nutrition and lifestyle. Dr. Pamela Atkins is a family practice physician. She focuses on a holistic approach. She's been in medical practice for 33 years, and she is currently practicing in Houston, Texas. So thank you very much, Dr. Atkins, for being here tonight. We appreciate it a great deal. We've been looking forward to this for as soon as Dr. Montgomery announced it, we got excited about it. So thank you for being here.
Well, I'm happy to be here, and thank you for having me. I always enjoy speaking to Dr. Montgomery's audiences. They seem to be always well-informed and have great questions. So I just wanted to talk about breast cancer prevention today. I think most of us know someone that has had breast cancer or breast cancer survivor. Could be a family member, could be a friend. But I just want to talk about taking back our power and prevention of breast cancer. I am a family practice physician. I am an MD. I practice with a holistic approach in Houston, Texas. And so I coach people on lifestyle and dietary changes, herbal medicine, and other modalities to help prevent chronic diseases and those that have chronic diseases to improve them. So that is what my passion is. So when we talk about statistics, we want to know that breast cancer, how common it is globally, and greater than 2.3 million or 12% of people, there are newly diagnosed breast cancer cases globally. So that is 685,000 deaths associated with breast cancer globally. Now, there's greater than 290,000 cases of breast cancer diagnosed in the U.S., and this is estimated for 2022. So 287,850 are women, more than 2,710 are men diagnosed in the United States, and estimated for 2022. Now, with these statistics, we know 1 out of 8 women in their lifetime will be diagnosed with breast cancer. And it was estimated it may eventually be 1 in 7, but I believe it's still 1 in 8. The highest mortality rate is in younger women that have more hormone activity going. So they say ages 20 to 59, but I would say peaks 40-year-olds or less. But 20 to 59 is that age range, greater mortality rate. Now, in African American women, the mortality rate is 41%. And the incidence of breast cancer with African American women, the age less than 45, is higher than white women. So white women overall have a slightly higher incidence of breast cancer than African American women, but when under 45-year age, the African American women are number one. When we talk about disparities, we want to know that Black women have 8% lower incidence compared to white women to get breast cancer, but 12% higher mortality rate. So it's believed that the mortality rate is higher due to many times delay in diagnosis or access to medical care, possibly. But we think there may be some other factors that may be going on as well. So according to the National Cancer Institute, 90 to 95% of breast cancers are lifestyle related. So in the picture, you see diet, you see, donuts and French fries and hamburgers. you see tobacco, you see alcohol, and you see the other picture is estrogen, Premarin. Definitely hormones can have an effect. I want to talk about factor one, which is alcohol. And I think it's not mentioned very often, but alcohol consumption is a concern, and it can be a contributory factor to breast cancer. And I think a well-kept secret. I mean, many times we see shows of wealthy people and prosperous people, and they're having cocktails and drinks and wine, but we want to think about it as far as our risk for certain cancers, including breast cancer. And so it can increase the risk not only for breast cancer, but esophageal cancer, oral cancer, cancer of the larynx, colon, rectum, and liver. The cancer incidence, well, what is recommended by the Cancer Society is that women should drink no more than one drink or serving of a drink per day, or men, they say 2 drinks per day. And if it's a glass of wine, a serving is 5 ounces. And we know many times when a goblet is filled with wine, it's more than 5 ounces. But this is not saying that this is a safe amount, but this is just general recommendations from the American Cancer Society. Now, the American Institute of Cancer Research does not recommend alcohol for cancer prevention at all, if we're interested in cancer prevention. So we want to know, we want to have that understanding. When we talk about alcohol, the WHO European region has taken a bold stand, and they say alcohol is one of the, in their words, biggest risk factors for breast cancer. Now, 7 out of 100 newly diagnosed breast cancer cases with the WHO European region is associated with alcohol. So when they say associated, it doesn't mean it's the only factor, because most cancers are multifactorial, I call it, many more than one factor. So this is one factor that can influence. They believe that alcohol causes 40,000 new breast cancer cases in their European region. And so it was stated that simply reducing alcohol consumption can reduce breast cancer risk. So next factor I wanted to talk about is diet and obesity. Now, it's very important what we put in our body. And my husband, Dr. Floyd Atkins, at our office, he always says it's the most important decision we make every day is what we pick up with our hands or a fork or a spoon and put into our mouth. And we want to make good choices so it is good for our body and not working against us. So when we choose foods, number one, we want to be conscious of things with pesticides in it. We want to choose more organics because the organic are healthier as opposed to pesticides, where pesticides are xenoestrogens, or another word for false estrogens, and they stimulate estrogen receptors. We want to be knowledgeable about what pesticides do. So that's why we choose organic. It can be from the store. It may have the 9 number. The first number on it will be a 9. Or we can go to a community garden where we know they grow without pesticides. If you go to a farmer's market, you want to be able to talk to the farmers and ask who grows without pesticides and herbicides. We want to also be aware with our foods that of other toxins or carcinogens that may be in our food that can stimulate potential cancer cells or cancer cells in our bodies. So we want to avoid things that can stimulate. The next factor I wanted to talk about is estrogen dominance. When we have an imbalance of hormones, that can increase the risk of stimulating breast cancer cells, and we don't want to do that. So we want to be aware. So estrogen dominance is just when there's an imbalance between estrogen and progesterone in our body. We don't have to have a super high amount of estrogen. So even postmenopausal, if estrogen comes down, but if we have an imbalance with progesterone, which many women do, it can increase overly stimulating estrogen sensitive or hormonally sensitive tissue in men and women. So that could be breast tissue, men and women, could be ovaries, could be uterus, and prostate for men. When we talk about a healthy diet to decrease the risk for estrogen dominance and obesity, we want to think about cruciferous vegetables. And these are vegetables like broccoli, cabbage, cauliflower, asparagus. These vegetables act upon the fat cells and block the aromatase enzyme in our body fat from stimulating testosterone to be changed back to estrogen. And so we can make more estrogen through that. So these type of vegetables block that. So sometimes we see these vegetables on a list called cancer fighting vegetables, but they are very helpful, and there are also supplements made of these vegetables called DIM or I3C. But we want to eat a healthy diet. We want more colorful vegetables and carrots, bell peppers. We want organic. You see, I'm talking about fresh produce. We don't want processed food. We want fresh produce. And so that's what we're aiming for. When I talk about hormone disruptors, I've talked before about xenoestrogens. These are false estrogens. These are things that act on the estrogen receptors in our body, the breast, uterus, ovary, prostate, to stimulate. And we don't want to stimulate. So false estrogens or synthetic estrogens are in birth control pills. Xenoestrogens are phthalates. Phthalates are in plastics, food containers, wrappers, etc. And usually these are plastic softener. These are softeners in plastic. So the more rigid plastic have less phthalates in it, and some may not have it. But you see on some plastics, they say BPA free, and that's what they're alluding to. They're trying to identify things that don't have phthalates in it. But we want to be careful of wrapping and storing food that have oils in it, because these phthalates are very lipophilic. They love lipids and fat, and they bind to them. And so we don't want to store things in a plastic wrap or plastic containers. We don't want to microwave at all, but definitely don't want to microwave in plastic, because that will help it migrate into our food. So I want to also talk about what can we do in conclusion to reverse estrogen dominance or to eat organic. I mentioned the environmental working group, increase plant-based diet, and more organic vegetables and fruits again, and avoid toxic substances, artificial sweeteners, and the processed meats, and acrylamides of fried foods, and the potato chips and things of that nature. We want to decrease the amount of sugar, honey, agave nectar. Even though it's natural, it still can stimulate estrogen. They can stimulate hormones, stimulate us to gain weight, and that can make us estrogen dominant. We talked about the high fructose corn syrup, even maple syrup. You really cut back on the sugar, because the sugar can stimulate cancer cells. Cancer cells love sugar, and so that's how they multiply. So we want to minimize that. And again, I said not to use prolonged hormones, HRT, BHRT, testosterone, DHEA can be converted to estrogen. So if we're taking just testosterone or DHEA, we want to make sure we're not still creating that estrogen dominance and imbalance. Some symptoms for younger women may notice breast tenderness, breast fullness, increased breast size. And so that can be a sign of estrogen dominance. Some women that are not having a cycle may still feel that. I wanted to mention sweat. It's good to sweat, and we don't always think about it, but it's good to exercise, helps lower body fat. Sweating helps decrease the toxins. The World Health Organization classified iodine deficiency as a urine excretion less than 0.05 milligrams. Now, usually when we supplement, a holistic practitioner supplements iodine, it's in milligrams. Most of the iodine you get in the health food store or in your multivitamin is in micrograms. So iodine, I usually recommend it in the form of Lugol's 5% iodine. I use it a lot topically on my patients. And I usually recommend them patch tested. Vitamin D3. Vitamin D3 is very important for prevention of cancer, most cancers, autoimmune disease. So cardiovascular disease. So it's important to know your level of vitamin D3 and have an optimal level of vitamin D3. 4-herb tea or Essiac tea, it is 4 herbs that help stimulate the immune system. So it helps the body work. And so it's stimulating the immune system. Many times it discourages cancer cells. And so this is a very helpful tea. They find it helpful for diabetes and other chronic diseases, but 4-herb tea usually does not interfere with most chemotherapy. I always tell people to check with their doctor, but it can help lessen the side effects. And so exactly the same things you use to prevent can be something helpful for people that are diagnosed. In conclusion, I just want to take back our power and know that to a large percent, we can determine our risks. We can determine or change the increased risk for breast cancer or decrease our risk for breast cancer in men and women by following some of these steps and taking back our power and knowing only a very small percentage is genetic. And even people with genetic history, still I would recommend to take back your power and to follow some of these recommendations. I thank you for the opportunity to speak with you tonight.
Thank you very much. Thank you, Jackie, for moderating. And I hope everybody has a great night tonight. And
thank you for having me.
No, it's a pleasure, all ours. We'll have you back soon. Y'all have a good night.
All right. Good night.